Hi, JP. It's nice to see you again. I'm Laura. We're going to go through a real quick skin assessment today. First, a couple of questions. Do you have a history of skin cancer at all?
No,
Okay. How much exposure do you have to the sun?
in my swimming pool,
Your swimming pool?
Just
How about
moderate.
day-to-day activities?
moderate,
Moderate amount. Do you wear any sunscreen?
not usually.
Okay. When you do have sun exposure, do you burn, tan?
I might get red a little bit, but the next day it tans.
Okay. We're going to go ahead and look at a few things. Just noting here, I note that your skin is normal colored, not dark skinned, but also not pale. You are Native American, correct?
Yes,
Okay. Then it would be typical for a Native American individual. Touching your skin, I can note that everything is warm and smooth. With no obvious problems with that. Um, I do notice on your lower extremities here that you do have some darkening of the skin. It's a little bit more thickened and somewhat dry. More so on your right extremity, a little less so on your left extremity. I do notice here on your arm also that you have a bit of a rash with these blisters. Do you have environmental exposure to plants or chemicals that you know of?
chemicals.
Chemicals? Any? You're an HVAC technician. Do you spend any of your time outdoors in people's
A
backyards?
lot of time.
A lot of times. Have you been in contact with any unknown plants
No.
or anything? Are you sure?
Poison ivy?
Poison ivy, have you had it? It looks like a little bit of contact dermatitis, a little blistering, likely in your day-to-day job, you've come in contact with a little bit of that. I noticed there are small moles, various different spots on your body. What I'm looking for on those is that they are asymmetrical. The borders are clean and normal. The color is, although some of them might be different, such as this one is a little darker than some of the rest. And each individual, they are a good normal color or routine color, and the diameters are small, although these are really relatively small. I'm going to go and look at your hands a little bit. I'm going to note here that on the palms you do have a little bit of thickening of the skin and some callousing. Your nail beds are pink, capillary refill is good. Your nails are normal and as expected. Looking at your feet, same thing. We can notice some callousing, some thickening of the skin, but your nails are pink. Capillary refill is good. I do note a little bit of yellowing on some of your nose, toenails here, which could indicate maybe a fungal infection. I do notice on occasion you do have some skin tags. Most of those are normal. It's just part of aging. I'm going to look at your hair here, and make sure your hair is clean and kept. Searching here for any type of infestation, and I'm not noticing anything there. No dandruff. Skin appears healthy. I do see a little bit of thinning back here, which would be normal for a male pattern baldness. I'm going to have you stand up so I can also check your back. Turn this way, and the same as the front, I'm going to notice that you do have a number of moles, but all of them do follow with them being symmetric, asymmetrical with normal color, normal borders, and small size. All right, you can have a seat again. Do you have any questions?
No.
Okay, so just a few things. The contact dermatitis, we're going to recommend that you keep that clean and dry. If you notice any signs of infection, you should seek out additional care. We could give you some things to help with comfort on that. If it gets to where it's disturbing your sleep patterns or affecting your daily life, give us a holler. We'll see what we can do on that. As far as the venous stasis dermatitis, your legs, that darkening color at your legs, that's related to blood flow. I did note in your chart that you have some diabetes and hypertension. It's likely related to that. Our recommendation there is that you keep your feet elevated where possible. Wear soft, loose, cotton-fitting clothing to not restrict any of the blood flow, and perhaps start wearing some compression stockings to help with that circulation. Skin tags are normal. Recommend that you do start using some sunblock, even with your Native American heritage. Too much sun exposure, even without a burn, could lead to skin cancer. Any other questions? All right, thanks for coming in. Appreciate it.